Welcome to Dr. Choice's module on scoring the M1830 bathing. Let's begin. First off, let's review two of the most important conventions in scoring the 1800s. All questions are to be scored before any inventions are performed. So therefore, if you give any verbal instructions, physical assistance, or environmental setup, you have intervened and cannot score them as independent. Safety, safety, safety. Safety is integral to ability. Every question is predicated on the safety factor. So I'm always going to score the patient at the level that would place them or describe them from free from risk. And oftentimes this would score them lower than what they're able to do because they're unsafe when they do it. Let's take a look at 1830. Let's take a look at 1830 for a moment here and some considerations. Remember, the focus of the question is to assess whether the patient can safely enter and exit the shower or tub area and then wash their entire body. Remember, this includes things that are often missed by the clinician. Do you look at their ability to pick up the soap or items from the floor when they're bathing? Their ability to adjust the temperature, ability to manipulate devices. This and several other considerations need to be looked at when you're talking about bathing, including can they effectively get to those tough to reach areas. It's not looking at whether they can get into or out of the bathroom, but this is looking at getting in and out of the shower and tub. So if we take a look at the question, you can see that it is set up in this format and has 6 different considerations for scoring. So let's take a look at each one of them. Let's take a look at how a patient would be scored a 0. Essentially, in this one, there is no help or assistance given at all. They are able to get in and out of the shower area safely and wash the entire body, not including the grooming of the head and face, safely. So keep in mind, washing the entire body is something that is often missed. Can they reach under the arms? Can they bend over and reach between the legs? Can they reach down to their feet without losing balance? That has to be considered because this score of 0 means they can completely enter and exit the shower but also clean themselves safely. Keep in mind the question is looking at the ability to access the shower tub areas. So what about the environment? Some homes have very narrow doorways. Maybe the walker doesn't fit in the right position in order to transfer in the area. Maybe it's cluttered. The environment has to be looked at because remember, the ability can be affected by not only physical, sensory, emotional, but environmental considerations. So therefore, if you deem the environment unsafe, even though they access the area, and in your opinion they are unsafe, then you cannot score them as being independent because the environment is not proper. But if you did score somebody a 0, this is telling us that they have no trouble getting in and out of the shower and can clean themselves effectively and safely. Scoring somebody as a 1 is essentially the same as scoring them a 0, except in this case they have some type of device, but otherwise can bathe themselves and enter and exit the shower safely. So they may have a grab bar, long-handled reacher, bath bench, etc. So in this case, you're not giving them any verbal, physical cues or any setup at all. If they are receiving any of these, they cannot be scored a 1. So again, very similar to ambulation, 0 and 1 in these measures do not support any occupational therapy training because they are independent in using these assisted devices. If they are not, then they cannot be scored a 1, they would be scored a 2. Again, safety is a key factor. So let's take a look at scoring a patient with 2. What does that mean? Well, a patient that scores a 2 should certainly have an occupational therapy evaluation performed on them. But scoring somebody a 2 means that they need some form of intermittent supervision. If they can be left alone for even a short period of time, the assistance is intermittent. So this could come in the form of needing emotional support, help getting in and out of the shower, as well as washing difficult areas, reminders, etc. It could be any form of intermittent help in order to be safe when doing the showering. What if, though, there's a patient that has several of these intermittent assistance? Is that really intermittent? Well, if they have one of the following, which we have already described above, it would be appropriate to score them a 2. But if there's more than 2 of these, a score of 3 would be appropriate. So keep that in mind when you're assessing somebody. If you're having to do multiple types of interventions, then the question is it really intermittent? In order to score a patient a 3, they do not require or are not safe with intermittent supervision, but require a person to provide supervision or assistance at all times. Keep in mind that even if somebody is receiving intermittent supervision, if you determine that constant supervision would make them the safest, then you need to score them as a 3. Because remember, these scorings indicate what would be the recommended or what is the safest level for this patient to be performing this task. Remember, emotional and fear and anxiety issues can play a significant role, particularly in the bathroom. So just don't consider the physical side. You must look at this as well, because remember, the ability of a person is affected not only by emotional, but physical, sensory, environmental setup. Those are all things that can be impacting ability. Also keep in mind that you're looking at their ability to effectively clean themselves, washing difficult areas, etc. And therefore that is something that needs to be considered. So in order to score somebody a 3, they are safely able to manage these tasks with constant supervision at all. 4 and 5 indicate that this patient cannot use the shower or tub, but can bathe either sitting at the sink or sitting near a sink, in a chair, on a bedside commode, whatever, in order to clean themselves. The difference between 4 and 5 is, in 5, somebody needs assistance or supervision of a person throughout the bathing period. Remember that assistance based on Medicare is not just physical, it's verbal and environmental setup. So if someone needs help setting up the basin at the bedsides, accessing the water, etc., they need assistance, and therefore 4 would not be appropriate. 5 would, because this person needs help getting prepared in order to do this. So to score somebody a 4, they are completely independent, not only in setting it up and getting to the area, but also washing their body entirely, safely and effectively. And if that's the case, then 4 would be appropriate. 5 means that they need assistance and help with sponge bathing. So keep that in mind, that they are participating but need some help. Scoring somebody a 6 indicates that they cannot effectively bathe themselves and should be bathed by another person. This is regardless of the location, so this could be with a sponge bathing or shower and tub. If they cannot effectively bathe themselves, remember this means cleaning their areas properly and thoroughly, or maybe they're breaking precautions with a hip replacement, they should be scored a 6. Returning to our previous conversation, remember you are to score them with an answer that would describe the safest level of function. So if you deem that somebody is breaking a precaution, and even though they may be bathing and doing the task, but they cannot do it effectively because their judgment's poor, etc., it would be appropriate to score them a 6 to indicate that really somebody should do the whole bathing process because this person cannot do it effectively. Again, look at safety to indicate ability, not just the physical performance alone. If a shower is not functioning, they are not safe, thus 4, 5, or 6 would be appropriate depending on the ability, and you'd have to look at that. If there's medical restrictions that preclude them from using the shower tub, then you would have to look at 4, 5, and 6. Remember fear. If someone has a real anxiety or fear due to previous falls in the shower tub, then you could score them a 4, 5, or 6 depending on how you assess their ability to sponge bathe and how to bathe effectively. Fear is a real inability, and this should be considered strongly when assessing this measure. Even if a patient with constant supervision or assistance of a person at all times is clearly not safe in the shower tub, what should the score be? It could be a 4, 5, or 6 depending on the ability to bathe in that fashion. Remember, safety is key. You must always look at that and also look at the effective way in which they can clean themselves. So depending on how you've assessed the patient's ability to sponge bathe, for example, they could be 4 or 5, and if they're not effectively performing it and should have somebody totally clean them, then you may indicate a 6. In this slide, we look at the environment and the assistance. 0 means that they're in the shower tub, they don't need no help at all. Same thing with number 1, except they have devices. These do not indicate occupational therapy, but the following remaining scores do. Showering in the tub with intermittent assistance, showering in the tub with constant assistance. 4 indicates that they should be using a sink, chair, or commode, or do use that, but they don't need any help at all. Same conditions under 5, except they need intermittent help or throughout the task. And 6 doesn't really matter, but they're totally dependent. Taking a quick look at the occupational therapy evaluation. In this section's where this information can be gathered for the clinical managers to take a look at the 1830 as well as the therapist to support it. In this section here, the most important information is describe the unique situation of the patient, describe the environment, describe their assistance that they need specifically, any safety issues, etc. All that information helps support a proper 1830. Some additional considerations. If the patient is medically restricted from climbing stairs, is unsafe in climbing stairs, and the only tub and shower is upstairs, they have a temporary inability to access it, such the environment. So you'd have to assess whether the patient can sponge bathe or bathe at all effectively, and 4 or 5 or maybe 6 could be indicated. 4 would mean that they're able to safely, independently bathe outside the shower and tub, including setup, and they don't need any help at all. 5 would indicate that they need some help. That completes our review of M1830. If you have any questions, please contact your rehab manager and/or speak to the Director of Clinical Services in your branch. Thank you.